It is Men's Health Month, and this morning we're talking about the risk of heart disease. The CDC says it's the leading cause of death for men here in the U.S., and that half of the men who die suddenly of heart disease have no previous symptoms. So that's pretty alarming. One Tempe man says he did have symptoms before his heart attack, but it wasn't what you would think. He woke up to what he thought was the flu. We're talking about Chris Fitzer here, who's also joined by his cardiologist, Dr. Sulay Patel, to talk about the experience. You had just finished playing in a basketball tournament. You're in good health. You woke up that morning, and what happened?
Yeah, I didn't feel very good. I felt tingling across my shoulders, and my wife took one look at me, and I was a little pale, and she snapped into action. She gave me a baby aspirin and called 911.
Thank goodness, right?
Yeah.
And then you were rushed to the hospital, and when did you find out you were having a heart attack?
It was a little weird for me because I was in and out of it the whole time. But Dr. Patel knew what to do, thank goodness.
What did you do? And it's weird to hear flu symptoms. I'd never heard that before.
Yeah, we see that a lot of people just have atypical symptoms. Not everyone has the classic chest pressure, tightness, or pain.
Okay.
A lot of people may have shortness of breath. They may feel nauseated. They may have some of this tingling in their arm or their shoulder. In Chris's case, I think the entire healthcare team at Banner Desert did an excellent job. From the paramedics who knew to bring him to the right hospital, to the ER staff who made a prompt diagnosis, and he got up to the cath lab where we were able to put in a stent, and then we put in the Impella device to help support his heart for a few days.
And this is what we're talking about. I think we've got a camera shot of this. Explain what this is.
So this is a temporary device that we can insert through the femoral artery into the heart, and it basically sits inside the heart, and it will propel blood out of the heart into the aorta, allowing the heart to rest and recover while the patient is recovering from their heart attack.
And that doesn't stay in there forever, right?
It doesn't. In Chris's case, we were able to take it out after a couple of days with some excellent care in the cardiac critical care unit. And he was able to get out of the hospital probably in about 10 days.
Gosh, that's amazing. We had a guest on here. We've had him on a couple times, Jerry Irvin. He had something similar, and he was dead for 40 minutes, and he's alive and doing great. So what are your thoughts about this whole thing? You have to be counting your lucky stars, right?
Yeah, definitely scary, and don't want to go through it again.
Yeah, but it's so odd. You've had 2 heart attacks, but no family history. You're in good health. You're young.
No high cholesterol, no high blood pressure. Totally gets you by surprise. So,
yeah.
I mean, anybody can have one. It's really scary.
Well, knowing that, who's at risk? I guess anybody, right?
Theoretically, anybody. As much as we know about heart disease, there's still so many things that we don't know. So, I would encourage anyone who's concerned, even if it's an atypical symptom, to get themselves checked out.
He mentioned his wife gave him an aspirin. We've heard in the past that was good to take one every day, and then I saw a study that it didn't do anything. What's the real truth there?
That issue is mainly based on when we're taking aspirin for prevention. Anyone with heart disease, or if they're concerned that they have heart disease, aspirin is definitely a benefit for them.
Yeah, it is. All right. Well, congratulations, and
thank you.
Man, I'm glad you're still around kicking it. You still playing basketball?
Oh yeah, I owe it all to this guy.
Yeah, you do.
And the little Impella thing, man,
Gosh.
that thing was awesome.
It's just incredible. You got to love medical
technology, man.
Advancements.
I tell you what.
That's for sure. So thank you both. The work you do is just amazing. So thank you, doctor.
I was just the guy laying there.
Chris, thank you so much.
Alrighty.